don't stop. Don't stop. Don't stop. Don't stop.
Sole of foot. Introduction. The structure of the sole is similar to that of the palm. The skin, superficial fascia, deep fascia, muscles, vessels, and nerves, are all comparable in these two homologous parts. However, unlike the hand, the foot is an organ of support and locomotion. Accordingly, the structures of the foot get modified. The great toe has lost its mobility and its power of prehension, the lesser four toes are markedly reduced in size, and the tarsal bones and the first metatarsal are enlarged to form a broad base for better support. The arches of the foot serve as elastic springs for efficient walking, running, jumping and supporting the body weight. Skin. OISSECTION. Skin of the sole usually becomes very hard. To remove it, the incision is given from heel through the root to the tip of the middle toe. Reflect the skin and fatty superficial fascia to each side of the sole. Look for cutaneous nerves and vessels. Features. The skin of the sole, like that of the palm, is 1. Thick for protection, 2. Firmly adherent to the underlying plantar aponeurosis, and 3. Creased. These features increase the efficiency of the grip of the sole on the ground. The skin is mainly supplied by 3 cutaneous nerves. The nerves are medial calcanean branches of the tibial nerve, to the posterior and medial portions, branches from the medial plantar nerve to the larger, anteromedial portion including the medial 3½ digits, and branches from the lateral plantar nerve to the smaller anterolateral portion including the lateral 1½ digits. Small areas on medial and lateral sides are innervated by saphenous and sural nerves. These nerves are derived from spinal nerves L4, L5, and S1. The segmental distribution is shown in Fig 10.2. In eliciting the plantar reflex, the area supplied by segment S1 is stimulated. Dissection. The deep fascia on the plantar aspect of toes is thickened to form fibrous flexor sheaths, proximally it is continuous with the plantar aponeurosis. Identify the cutaneous branches from medial and lateral plantar arteries and nerves on the respective sides of plantar aponeurosis. Between the 5 distal slips of the aponeurosis trace the digital nerves and vessels from medial plantar nerve and vessels for 3½ medial toes and from lateral plantar nerve and vessels for lateral 1½ toes. Divide the plantar aponeurosis 4 cm distal to the heel. Reflect the cut ends both proximally and distally. This exposes the 3 muscles of the first layer of sole. Medial plantar nerve and vessels are easily visualized close to the medial border of sole. Stems of lateral plantar nerve and vessels including its superficial division are also seen. Superficial fascia. The superficial fascia of the sole is fibrous and dense. Fibrous bands bind the skin to the deep fascia or plantar aponeurosis, and divide the subcutaneous fat into small tight compartments which serve as water cushions and reinforce the spring effect of the arches of the foot during walking, running and jumping. The fascia is very thick and dense over the weight-bearing points. It contains cutaneous nerves and vessels. Thickened bands of superficial fascia stretch across the roots of the toes forming the superficial transverse metatarsal ligaments. Deep fascia. The deep fascia of the sole is specialized to form 1. Plantar aponeurosis. 2. The deep transverse metatarsal ligaments between the metatarsophalangeal joints. 3. The fibrous flexors jaws in the toes. Plantar aponeurosis. The deep fascia covering the sole is thick in the center and thin at the sides. The thickened central part is known as the plantar end poikilosis, Fig 10.3. Aponeurosis represents the distal part of the plantaris which has become separated from the rest of the muscle during evolution because of the enlargement of the heel. The aponeurosis is triangular in shape. The apex is proximal. It is attached to the medial tubercle of the calcaneum, proximal to the attachment of the flexor digitorum brevis. The base is distal. It divides into 5 processes near the heads of the metatarsal bones. The digital nerves and vessels pass through the intervals between the processes. Each process splits, opposite the metatarsophalangeal joints, into a superficial and a deep slip. The superficial slip is attached to dermis of skin. The deep slip divides into two parts which embrace the flexor tendons, and blend with the fibrous flexor sheaths and with the deep transverse metatarsal ligaments. From the margins of the aponeurosis, lateral and medial vertical inframuscular septa pass deeply, and divide the sole into three compartments. Thinner transverse septa arise from the vertical septa and divide the muscles of the sole into four layers. Functions: 1. It fixes the skin of the sole. 2. It protects deeper structures. 3. It helps in maintaining the longitudinal arches of the foot. 4. It gives origin to muscles of the first layer of the sole. The plantar aponeurosis differs from the palmar aponeurosis in giving off an additional process to the great toe, which restricts the movements of the latter deep transverse metatarsal ligaments. These are four short, flat bands which connect the plantar ligaments of the adjoining metatarsophalangeal joints. They are related dorsally to the interossei, and ventrally to the lumbricals and the digital vessels and nerves. Fibrous flexor sheaths. These are made up of the deep fascia of the toes. Their structure is similar to that of the fibrous flexor sheaths of the fingers. They retain the flexor tendons in position during flexion of the toes, Fig 10.3. Clinical anatomy. Plantar fasciitis occurs in policemen due to stretching of the plantar aponeurosis. This results in pain in the heel region, especially during standing. Muscles of sole. The muscles of the sole are arranged in four layers, which will be considered one by one. Dissection. Cut through the flexor digitorum brevis near its middle, taking care to preserve the underlying lateral plantar nerve and vessels. Reflect the distal part distally till the toes. Detach the abductor digiti minimi and identify the lateral head of the flexor digitorum accessorius till its insa 1 ion into the tendon of flexor digitorum longus. Trace the long flexor tendons through the fibrous flexor sheath into the base of distal phalanges of toes. Follow the lumbricals to their insertion into the base of the proximal phalanx and into the extensor expansion of the dorsum of toes. Study the muscles of second layer comprising the long flexor tendons and associated muscles. Cut through both the long flexor tendons, flexor hallosus longus and flexor digitorum longus, and flexor digitorum accessorius where all the three are united to each other. Reflect the ends proximally and distally to reveal the muscles of third layer of sole. These muscles are described in tables 10.1 and 10.2 and shown in figs 10.4a and b. Muscles of second layer. The contents of second layer are the tendons of the flexor digitorum longus, and of the flexor hallosus longus, and the flexor digitorum accessorius and lumbrical muscles. The muscles are described in tables 10.3 and 10.4. Dissection. Separate flexor hallosus brevis and oblique head of adductor hallosus from their origin and reflect them distally. Preserve the plantar arch and deep plantar nerve. Look for sesamoid bones at the insertion of flexor hallosus brevis. Reflect the transverse head of adductor hallosus medially. On cutting the deep transverse metatarsal ligament on both sides of second toe, tendons of interossei muscles are recognized. Detach the flexor digiti minimi brevis from its origin and reflect it forwards. This will show the laterally situated interossei muscles. Identify and examine the attachment of tendon of tibialis posterior on the medial side of foot. Trace the course of tendon of peroneus longus through the groove in the cuboid bone across the sole to its insertions into lateral sides of base of first metatarsal and medial cuneiform bone. After studying the muscles of the third layer, detach them from their origins towards their insertions. The muscles of the fourth layer are visualized. Muscles of the third layer. The third layer of the sole contains three muscles. These are the exergitolysis brevis, therefore digiti minimi reris, and the adductor deflex, figs 10.6a and b. They are described in tables 10.5 and 10.6. Muscles of the fourth layer. The structures present in the fourth layer of the sole are the interosseous muscles, and the femoris of the tibialis posterior and of the peroneus longus. Interosseous muscles of the foot. These are small muscles placed between the metatarsal bones. There are 3 plantar and your dorsal interossei. Dissection. Dissect the medial plantar nerve and vessels on the medial side of sole. Lateral plantar nerve and vessels also enter the sole from the medial side. These cross the sole to reach the lateral side. Here lateral plantar artery forms a plantar arch across the sole which gives numerous branches. The lateral plantar nerve divides into a superficial and deep branch. The latter runs in the concavity of the plantar arch. The coarse branches of nerves and vessels are given in the text. Features. The chief arteries of the sole are the medial and lateral plantar arteries. They are terminal branches of the posterior tibial artery. 2. The chief nerves of the sole are the medial and lateral plantar nerves. They are terminal branches of the tibial nerve. 3. These arteries and nerves begin deep to the flexor retinaculum. The posterior tibial artery divides into the medial and lateral plantar arteries a little higher than the division of tibial nerve. As a result, the arteries are closer to the margins of the sole than the corresponding nerves. 4. The medial plantar vessels and nerve lie between the abductor hallucis and the flexor digitorum brevis. 5. The lateral plantar vessels and nerve run obliquely towards the base of the 5th metatarsal bone, between the first and second layers of the sole. Here the artery turns medially and becomes continuous with the plantar arch. This arch lies between the 3rd and 4th layers of the sole, Fig 10.9. The plantar arch is accompanied by the deep branch of the lateral plantar nerve. Medial plantar nerve. Origin and course. Medial plantar nerve is the larger terminal branch of the tibial nerve. It passes forwards between abductor hallucis and flexor digitorum brevis and divides into its branches. In its distribution, it resembles the median nerve of the hand. Branches. Its muscular branches supply 4 muscles as follows. 1. The abductor hallucis. 2. The flexor digitorum brevis. 3. The flexor hallucis brevis receives a branch from the first digital nerve. Cutaneous branches supply the skin of the medial part of the sole, and of the medial 3½ toes through 4 digital branches. The first lumbrical muscle receives a branch from the second digital nerve. 1. The first digital nerve supplies the medial side of the great toe. 2. The second nerve supplies the adjacent sides of the first and second toes. The third nerve supplies the adjacent sides of the second and third toes. The fourth nerve supplies the adjacent side of the third and fourth toes. Each digital nerve gives off a dorsal branch which supplies structures around the nail of the digit concerned. Articular branches supply joints of the tarsus and metatarsus. Lateral plantar nerve. Lateral plantar nerve is the smaller terminal branch of the tibial nerve. It passes laterally and forwards till base of 5th metatarsal, where it divides into superficial and deep branches. In its distribution, it resembles the ulnar nerve in the hand. Branches. The main trunk supplies 2 muscles, the flexor digiti maximus and the abductor digiti minimi, and the skin of the sole. The main trunk ends by dividing into superficial and deep branches. The superficial branch divides into 2 branches, lateral and medial. The lateral branch supplies 3 muscles: tenor digiti minimi brevis, the third plantar and lateral dorsal interossei, and the skin on the lateral side of the little toe. The medial branch communicates with the medial plantar nerve, and supplies the skin lining the 4th interdigital cleft. The deep branch supplies 9 muscles, including the 2nd, 3rd, and 4th lumbricals, 1st, 2nd, and 3rd dorsal interossei, 1st and 2nd plantar interossei and adductor hallucis. A neuroma may be formed on the branch of medial plantar nerve between 3rd and 4th metatarsal bones. It is called Morton's neuroma, Fig 10.4b. This causes pain between 3rd and 4th metatarsals. It may be also due to pressure on digital nerve between 3rd and 4th metatarsals. Any of the digital nerves, especially the one in the 3rd interdigital cleft, may develop neuroma. This is a Peyrt-Fool condition. Medial plantar artery. Beginning, course and termination. Medial plantar artery is a smaller terminal branch of the posterior tibial artery. It lies along the medial border of foot and divides into branches. Branches. It gives off cutaneous, muscular branches to the overlying skin and to the adjoining muscles, and 3 small superficial digital branches that end by joining the first, second, and third plantar metatarsal arteries. Lateral plantar artery. Beginning, course and termination. Lateral plantar artery is the larger terminal branch of the posterior tibial artery. At the base of the 5th metatarsal bone it gives a superficial branch and then continues as the plantar arch, Figs 10.9 and 10.10. Branches. Branches supply the adjoining muscles. Cutaneous branches supply the skin and fascia of skin. Lateral part of the sole. Anastomotic pranches reach th lateral border of the foot. A calcanean /T is occasionally given off to the skin of the heel. Plantar arch. Beginning, course and termination. Plantar arch is formed by the direct continuation of the lateral plantar artery after it has given off the superficial branch and is completed medially by the dorsalis pedis artery. It extends from the base of the 5th metatarsal bone to the proximal part of the first intermetatarsal space, and lies between the 3rd and 4th layers of the sole. It is accompanied by vena comitans. The deep branch of the lateral plantar nerve lies in the concavity of the plantar arch. Branches of the plantar arch. 4 plantar metatarsal arteries run distally, 1 in each intermetatarsal space. Each artery ends by dividing into 2 plantar digital branches for adjacent sides of 2 digits. The first artery also gives off a branch to the medial side of the great toe. The lateral side of the little toe gets a direct branch from the lateral plantar artery. The plantar arch gives off 3 proximal perforating arteries that pass through the 2nd, 3rd, and 4th intermetatarsal spaces and communicate with the dorsal metatarsal arteries, which are the branches of the arcuate artery. The distal end of each plantar metatarsal artery gives off a distal perforating artery which joins the distal part of the corresponding dorsal metatarsal artery. Fracture of shaft of 2nd/3rd/4th/metatarsal bones is called march fracture. It is seen in army personnel, policemen, as they have to march a lot. It occurs due to decalcification and vascular necrosis. Normal architecture of foot is subjected to insults due to high heels. Females apparently look taller, smarter, but may suffer from sprains and dislocations of the ankle joint. Toes may be spread out or splayed. Longitudinal arches are exaggerated, leading to pes cavus. If foot is dorsiflexed, person walks on the heel, condition is called talipes calcaneus. If foot is plantar flexed, person walks on toes. The condition is called talipes equinus. If medial border of foot is raised, person walks on lateral border of foot. The condition is talipes varus. If lateral border of foot is raised, person walks on medial border of foot. The condition is called talipes valgus. Most common is talipes equinovarus, in which the heel is medial, the foot is plantar flexed and inverted with high medial longitudinal arch. Muscles of the sole are disposed in 4 layers. Medial plantar nerve supplies 4 intrinsic muscles. Lateral plantar nerve supplies 14 intrinsic muscles. Extrinsic muscles are supplied by the nerve of the respective compartments of the leg. Only one arterial arch, the plantar arch, is present. The muscles of the sole maintain the arches of the foot. A. Muscular branches to abductor hallucis, flexor digitorum brevis, both of first layer of sole, first lumbrical of second layer of sole, and flexor hallucis brevis of third layer of sole. B. The nerve gives 7 digital branches to adjacent sides of medial 3 toes, including their nail beds and distal phalanges on the dorsum of foot. C. It also gives articular branches to the joints in its territory of distribution.